27 cases of the Omicron variant have been detected in Kenya. This being based on the latest genetic sequencing by the Ministry of Health that was conducted on 34 samples between the 23rd of November and the 7th of December. And as Raquel Mugai reports, ongoing transmission amongst the Kenyan population could be higher than reported, as only 2 out of the sequenced 27 cases had history of travel outside the country.
On 8th December, the Health Cabinet Secretary reported only 3 cases of the Omicron variant detected in Kenya. 3 days later, and the Ministry of Health confirms that there are 27 cases of the variant that have been detected out of 34 samples that underwent genomic sequencing. Of greatest concern, however, is that only 2 of these cases had history of travel, one having travelled from South Africa and the other from Ghana. The rest of the 25 cases are of local transmissions. And while this data confirms the presence of the Omicron variant between the dates of 27th November to 7th December, the cases of the variant could indeed be higher than reported.
This variant is there with us. It is going to spread. There is no question about it. And it's a question of us preparing ourselves. We have urged that through the COG that all counties begin serious preparation for any eventuality.
An eventuality that is better prepared for if the numbers by the Ministry of Health are anything to go by. Over the last 10 days, the numbers of those in home-based care and in intensive care units have also increased from 833 persons in home-based care on 9th December to 4,474 on 18th December. In the same period, it has been 2 patients for a majority of those days that were admitted in the intensive care unit. The last 3 days, that number now stands at 9 patients in the ICU. For a variant whose severity is yet to be deeply understood, such spikes are not just numbers. It is such scenarios that have now seen countries across the region and the world now effect new measures. Rwanda has imposed a 10 p.m. curfew, with all businesses now being ordered to close by 9 p.m. The popular mass sports and car-free day have also been suspended, while bars, restaurants and all services held at places of worship have been allowed to continue. They have been restricted on the number of people they host, with Kigali and secondary cities stating that all clients, attendees must be fully vaccinated. Other countries, especially in Europe, are now pushing for new restrictions on testing, especially for travellers.
This is no time to debate. This is no time to start hesitating when it comes to getting vaccinated. The statistics are clear. In the countries that have got a widespread Omicron variant, it is clear that if you have been vaccinated, you are much better off.
So far, only 3.5 million people have been fully vaccinated in Kenya. Another 5.2 million have been partially vaccinated. In the last 24 hours, 2,169 new infections have been reported out of a sample size of 9,428. The positivity rate now stands at a high of 23%. Nairobi leads with 1,230 cases, Kiambu 258, Nakuru 116, Kajiado 83 and Machakos 61. The other cases are spread out across 31 additional counties. Raquel Mugai, Citizen TV.